10 Best Diabetes Exercises. Hi guys, welcome to my channel. Before we get started, make sure to hit that like button, also subscribe to my channel. 10 Best Diabetes Exercises. So make sure to watch the full video. How can exercise help you manage type 2 diabetes? Let's first look at how type 2 diabetes affects blood sugar, glucose, levels. Your pancreas produces insulin, which allows your cells to take sugar from the blood and use it for energy. When you have T2DM, your cells don't respond normally to insulin resistance, and your pancreas makes more to compensate. This can cause your blood sugar levels to rise, leading to a diagnosis of prediabetes or T2 German marks. Fortunately, physical activity can help you manage the effects of type 2 diabetes. For example, regular exercise can lower blood sugar levels. Over time, regular exercise can lower blood sugar levels. Helps cells respond better to insulin. Exercise improves insulin sensitivity so cells can use the hormone more efficiently. Promotes healthy weight loss. Moderate intensity exercise can help you achieve healthy weight loss, which can prevent or reverse T2 German marks. Reduces risk of cardiovascular disease. Type 2 diabetes increases your risk of cardiovascular diseases such as heart attack and stroke. Fortunately, combined physical training can reduce these cardiovascular risk factors. Maintenance of muscle strength. Diabetes is a risk factor for low muscle mass and strength. Regular physical activity can help you maintain muscle strength. How often should you exercise if you have type 2 diabetes? General guidelines recommend weekly aerobic and strength training for people with type 2 diabetes. Strength training or aerobic exercise can help control your blood sugar. But a combination of the two works even better. According to these guidelines, you should do 150 minutes of aerobic exercise and resistance training 2 to 3 times a week. The American Diabetes Association, ADA, recommends exercising daily to achieve these goals. But if it doesn't fit into your schedule, they recommend going no more than 2 days in a row without exercising. These recommendations do not apply to everyone with type 2 diabetes. For example, lifting weights or doing high-intensity aerobic exercise may not be safe if you have certain medical conditions in addition to diabetes. Therefore, it is best to consult your healthcare provider before beginning any treatment regimen when you have type 2 diabetes. Regular exercise can do more than just keep you fit. Daily exercise helps lower blood sugar and makes cells more sensitive to the action of insulin. Being more active can also lower your A1C levels. Staying healthy has many other benefits. Diabetes increases the risk of heart disease. Exercise can help you manage your weight, lower your LDL, bad cholesterol, levels, and increase your HDL, good cholesterol, levels, all of which are good for your heart. The American Diabetes Association, ADA, recommends adults with diabetes get at least 150 minutes of moderate to vigorous aerobic activity per week. Combine this with strength training 2 to 3 times a week for seniors. The ADA also recommends flexibility and balance exercises 2 to 3 times per week. You don't need an expensive gym membership to be more active. You don't even have to leave your house. Here are some exercises you can try at home. 10. Walking. Walking is one of the easiest aerobic exercises to do, and you don't need any equipment, just your 2 feet. To ensure you're getting the steps you need each day, take a 5 to 10 minute break from what you're doing every 30 minutes and go for a walk outside or around your house. Aim to get in at least 30 minutes of walking or another aerobic exercise each day. You can walk in the place, down the hall, up and down the stairs, or you can use a treadmill. Household chores that involve walking, like mopping or vacuuming, also count. 9. Yoga. Yoga is a 5,000-year-old practice that strengthens the body, improves flexibility, and calms the mind. It incorporates poses, stretching, and deep breathing. This practice has been investigated for several health conditions, including diabetes. Practicing yoga regularly improves blood glucose control and helps prevent diabetes complications. Yoga also incorporates balance exercises, which can help you avoid a fall if you're unsteady from diabetic nerve damage, neuropathy. Some styles of yoga are safer than others for people with diabetes. Take a class or follow along with a video to learn how to do the poses correctly. Never push beyond your comfort level or to the point of pain. Be sure to move out of poses slowly to avoid sudden blood pressure drops. 8. Pilates. The Pilates method is named for Joseph Pilates, who created this exercise program in the 1920s. It consists of low-impact exercises that strengthen the core muscles and improve balance and posture. Small studies suggest that practicing Pilates for 12 weeks improves blood sugar control. Trusted source and quality of life factors like fatigue and pain in women with type 2 diabetes. Some in-studio Pilates programs use special equipment, but you can do these exercises with nothing more than a mat in your own home. 7. Dance. Spice up your aerobic routine by dancing pop in a ballet, or bar, Zumba, or another dance video, or download a workout from your favorite streaming service and follow along. A 2015 study found that taking a Zumba class motivated women with type 2 diabetes to exercise more. They also lost weight. 6. Bicycle or elliptical machine. An exercise bike or elliptical machine gives you an aerobic workout without putting stress on your joints. That's important. Considering that people with type 2 diabetes are more likely to develop osteoarthritis than those without diabetes, some fitness machines offer classes to give you the gym experience at home. 5. High-intensity interval training, HIIT. Short on time? Try high-intensity interval training, HIIT, which squeezes all the benefits of a longer workout into just 20 or 30 minutes. To do HIIT, alternate 30 seconds of intense exercise, such as sprinting in place and jumping, with 2 minutes of moderate intensity exercises to give your body a chance to recover. HIIT improved both glucose metabolism and insulin sensitivity in people with type 2 diabetes. Over 2 weeks, the HIIT group achieved twice the improvement of the group that did moderate intensity workouts. As the name suggests, HIIT is intense. It's not safe for everyone with diabetes or other health conditions. Check with your doctor to make sure you're healthy enough to do this program. 4. Stretching. Although stretching doesn't affect blood sugar control, it will keep your joints more flexible. That's especially important if you have arthritis along with diabetes. Ask your trainer or physical therapist to teach you stretches that are safe and easy to do. 3. Resistance training. Working against the force of resistance increases muscle mass and strengthens your body. You can use light weights, resistance bands, or your body weight, think planks, to build strength. In people with type 2 diabetes, resistance training may help improve blood sugar control and insulin resistance, lower blood pressure, and trim fat. If you're just starting, work out with a trainer or physical therapist for a few sessions. They can teach you what exercises to do and how to do them safely to avoid injury. 2. Combining workouts. These workouts will have the greatest impact on your health when you combine them. Alternate walking or cycling, which is good for your cardiovascular health, with resistance training, which strengthens your muscles. Add yoga for strength, balance, and relaxation. And don't forget to stretch a couple of days a week. 1. Exercise and blood sugar. One downside to working out with diabetes is that it can cause a drop in blood sugar, also called hypoglycemia. Anyone who takes insulin should test their blood sugar before working out. You may need to lower your insulin dose to avoid dipping too low to exercise safely. Your pre-exercise blood sugar should be between 90 and 250 milligrams deciliter, mg per deciliter. Some people need to take in carbohydrates at the beginning of their workout to prevent hypoglycemia. Be sure to contact your doctor if your blood sugar runs on the lower side of normal. Avoid high-intensity exercise if your blood sugar is over 250 milligrams per deciliter. Intense exercise might cause it to spike even higher. Altering your workout slightly can prevent hypoglycemia. For example, doing resistance exercises before aerobics produces less of a blood sugar drop than working out the other way around. To exercise safely, blood sugar should be between 90 and 250 milligrams per deciliter, milligram per deciliter. Before exercise, some people need carbs at the start of their workout to prevent hypoglycemia. It is important to contact your doctor if your blood sugar is lower than normal. Avoid high-intensity exercise if your blood sugar is above 250 mg per deciliter. Intense exercise will cause it to rise even higher. Small changes to your exercise routine can prevent hypoglycemia. For example, resistance training before aerobic exercise lowers blood sugar more than the reverse. Safety primer: if you haven't exercised in a while, check with your doctor to make sure it's safe to do so. Also, talk to your doctor if you are considering increasing your exercise intensity. Here are some tips for staying safe while exercising. If you're new to fitness, start slow. It's okay if you can only walk 10 minutes or lift 3 pounds on your first try. Gradually increase the time, resistance, and intensity as you get fitter and stronger. Wear padded athletic shoes when exercising. Do not exercise barefoot. Nerve damage can prevent you from noticing cuts or other damage to your feet if you have proliferative diabetic retinopathy. Avoid jumping, holding your breath, or standing on your head when your head is under your body. Always stretch before exercising to avoid joint injury. What do you think of our video? Let me know in the comments section below. If you enjoyed this video, make sure to hit that like button. Also subscribe to our channel before you go.